looking forward to being part of the shaping of a healthcare system with the patient being in the center.
And the medical system's been really good to me so far. So maybe I can return the favor to other people and the medical system.
I got involved with the Patient Voices Network because I really have always had a belief that patients should be sort of the central and pivotal voice within healthcare delivery.
I knew that there needs to be some changes made in healthcare, and this sounded like a wonderful way to do it.
Patient Voices Network, a way for patients and their families to be heard in transforming healthcare in BC. A unique and groundbreaking initiative.
This is a picture of my mother-in-law, Fervid Trimble. Fervid, her name, means intense or passionate, and she was. She was also passionate about coffee.
Johanna Trimble was one of the first patients to join the network.
What really got me passionate about being involved was going through the illness and death of my mother-in-law, who I was very fond of, and seeing all of the problems that she had, many of them preventable.
The expertise around this table is really
Patient
amazing.
Voices Network is unique in the world. It's a BC Ministry of Health Patients as Partners initiative administered by Impact BC. It's guided by a provincial steering committee. Patient Voices Network recruits, trains, and supports patients and their families to become partners in their own health care and in transforming the system.
There's a huge focus nationally, internationally now, is around having patients, families, and caregivers participate in the redesign, in quality improvement, and actually improving the system. And you hear that across the country, but across the world, that there's more and more of a focus on nothing about me without me.
It's important to hear out what the real people have to say, not researchers or scientific journals or papers.
The cost of healthcare is skyrocketing and something needs to be done. So I thought, well, this looked like a good opportunity to get in and see if there's something I could contribute to help make changes that would be better.
Anyone can join the Patient Voices Network online. Membership gives access to information on health system changes in BC, to surveys and polls, to webinars and skill-building opportunities.
So how did you hear about the Patient Voices Network?
Members of the Patient Voices Network who want to become more involved in shaping healthcare in BC can apply to become activated members. An intake interview is followed by an orientation, first online, and then face-to-face.
So today basically is a general orientation.
The purpose of these orientations is to describe the roles and responsibilities of a patient partner, what to expect as an activated member of the Patient Voices Network, and how to work alongside others to improve healthcare in BC. Volunteering as an activated patient could involve anything from participating on advisory committees or focus groups, to sharing personal stories at conferences, to commenting on health reports or new policies. The scope of engagements and the range of organizations seeking patient input is diverse and growing.
When Patient Voices Networks gets requests, they send out an email to everybody saying, here's what the committee is, here's what they want, are you interested?
Well, thank you, Johanna, first of all, for being willing to attend.
We usually do get a briefing for about an hour before the event. After the event, there's usually either a survey or debriefing about how it's gone. I found in any of the meetings or committees that I've been on that the medical people are extremely welcoming, really enthusiastic about having patient members.
Clay Barber is one of those enthusiastic stakeholders. Patient Voices Network helped him engage patients on a shared care committee of specialists and family physicians.
The discussion was around how to best communicate, whether a formal letter, email would be nice, etc. It was interesting. We had one of our more senior Patient Voices Network members there, and he spoke to why are we faxing, why are we sending mail? If we could have this online, it would be so much easier.
So the patient voice is starting to be heard in BC and abroad. Johanna Trimble is now on her way to Amsterdam to present a poster at an international conference on patient engagement. She'll share her journey with the Patient Voices Network and Fervid's story with the world.
The patients that are involved in the network are very positive and see this as new opportunities for a better health system.
A healthcare system that actively reflects the needs and interests of the people it serves, the patients.